Administering medication safely is one of the most crucial responsibilities you'll carry as a nurse, but do you know all 10 of the rights of medicine administration? Hello, you're on Shift with Sian, the platform that empowers student nurses with the knowledge, tools and the support to build confidence in practice. So today then, we're looking at the rights of medicine administration. It's an essential framework for ensuring medication safety. Now, knowing these will help you in your OSCE exams, on placement, and when you're practicing as a nurse. Because even the smallest mistake can have serious consequences, but applying these rights, you can create a habit that guards you against things like wrong patient errors, so administering to the opposite bed, drug mix-ups with lookalike names, drug calculations, especially in high-risk drugs, IV or IM rate confusions, timing oversight, so giving early or late doses, and documentation gaps that can make it impossible to read or to audit. So I have created a free download. It's a prompt for you to remember all 10 of the rights of medicine administration. Just head to www.shiftwithsian.co.uk and it's under the free resources tab. Go and download it now so you don't forget. You can have it in your pocket ready for your placement or when you're on shift. Right patient. So giving a patient somebody else's medications can be catastrophic. They could be allergic to the medication or already taking a medication that can't be taken with this one, causing adverse side effects. Now, don't just scan their wristband against the prescription. Ask the patient their name. The right drug. Lookalike names are everywhere. Medications like amlodipine for hypertension look like amitriptyline, which is an antidepressant, similar names with totally different uses. Read it 3 times against the prescription when you pick it up, when you draw it up, and when you give it. The right dose. Even a milligram too much or too little can tip the balance. There's a huge difference between micrograms and milligrams. In fact, it's 100 times difference. You don't want to under or overdose somebody by 100 times because you didn't see that C. So check your milligrams and your micrograms. If it's not clear on your prescription, go and check it out. Use a calculator if you're working out weight-based medications. And medications like heparin or insulin or chemotherapy medications, you need really to get checked against another nurse. The right time. So therapeutic levels depend on timing. That means that some medications work better in the morning, after food, or when the patient is sleeping. It's also important to check when the last time a medication was given. For example, if paracetamol is given 3 hourly instead of 4 hourly, it can lead to an overdose. Set alarms on your phone 10 minutes before critical medication is due. I do this mostly for Parkinson's medications, but it also helps to remind other people that you need to give that critical medication, so they're less likely to ask you to do something within that time frame. And you can always say, I've got 10 minutes to give this critical medication, I'll do that and then I'll come and help you. The right route. So a liquid suspension meant for an oral use down an IV line is a disaster. This could lead to death, so check and check again. If it's a handwritten prescription and you're not 100% sure of the route, get it confirmed by the prescriber. Some trusts will have different coloured syringes for IV and oral suspension. If it's there, use it as an additional check. Right documentation. If it's not charted, there's no proof that you've either given or admitted that medication. So chart it at the bedside right after you've administered it. Even if the patient's refused, still chart that the patient's refused. So don't be afraid to tell the patient that you need to see them having that medication in order to document it. Make sure that it's legible and that it's absolutely clear for the next person. Pop the date, the time given, and whether it was admitted and the reason, and make sure that you sign it. So you may have heard of those 6 R's of medicine administration, but here are the other 4 that add an extra layer of safety when administering medications. So right patient education. If a patient doesn't understand why they're taking something, adherence drops and side effects often go unnoticed. Education empowers patients to take responsibility for their health and that builds that trust in you as a nurse. Ask the patient, can you tell me why you're taking this medication? If they don't know, give them a brief description of the mechanism of action and highlight some key side effects and document this discussion. The right to refuse. So even if you know that this medication is essential, the patient has a legal right to decline, provided they have capacity. And in the UK, that means presuming capacity unless stated otherwise. Just because you think it might be an unwise decision not to take these medications, the patient have the right to choose this. So stay calm and don't get defensive or pushy. Respectfully ask why. And it might be because they have fear of one of the side effects, which then you might be able to do something about. So listen, then explain why it's been prescribed. If they still refuse, respect that decision, document it and escalate it to the medical team that you've not been able to give that medication. The right assessment then. So giving a medication without checking it safe can cause real harm. So check baseline observations. If you're going to give a blood pressure medication that lowers blood pressure, make sure that blood pressure isn't already low, else you're going to push it further down. Check the contraindications and also check the patient's allergy status. Ask, does my patient need to take this? If it's an antiemetic that's on a rolling prescription because they were nauseous 3 days ago and now they're fine, does your patient really need it? If they don't, escalate to the medical team to see if it can be removed. Right evaluation. So given the drug is only half of the job, you need to check that it's working. So if you've given an analgesia, you need to check that their pain has reduced. If you've given an antihypertensive, that their blood pressure has reduced. Assess for side effects and report them. So these are the 10 rights of a medicine administration, but now how do you make it a habit? You can download those 10 rights checklist to carry on placement and shift on my website under the free resources tab. You could also put up posters in clinical areas showing those rights so that others do the same, creating that safer culture. A little peer culture, so encourage the question everything teamwork. That friendly double check does save lives. And reflect. Any near misses, walk through those 10 rights to spot any mistakes and learn from them. So the rights aren't just a checklist, they're a foundation for safer nursing care. Make them a non-negotiable routine and it will give you the confidence to handle even the most complex medication regimes. So don't forget to subscribe to my channel for more clinical skills and let me know in the comments what you want me to cover next. Be kind to yourself, we've got this.